This short module illustrates a template for you to systematically identify and analyze ethical issues. This model will be utilized throughout this course and provides a framework for learning a decision-making process. We hope that this experience will encourage you to utilize this or similar tools as you encounter ethical issues in your professional practice. Effective decision-making follows a well-thought-out process. By reviewing each of these factors as you analyze the case studies within this course, your skills at ethical decision-making will improve. What is the ethical question or issue? Can you phrase it as a should question, such as what should you do? Who should decide? One of the first considerations in addressing an ethical issue is to consider your own gut reaction or emotional response towards the issue. It's important to understand your initial perception and why you feel the way you do. Your initial point of view may or may not hold true as you learn more about the facts of the situation, hear from others involved, and explore options and their consequences. The French diarist Anaïs Nin wrote that we don't see things as they are, we see them as we are. It is crucial to be able to understand that our preconceptions, our biases are like lenses through which we perceive situations and persons. Our emotions are like compasses, sometimes guiding us and sometimes leading us astray. Physician-writer Jerome Groopman recently said that he wished he had been taught, that he had gained the self-awareness to realize how emotions can blur a health professional's ability to listen and think. He tells the following story. One of my patients was a middle-aged, overweight woman with seemingly endless complaints whose voice sounded like a nail scratching a blackboard. One day she had a new complaint, discomfort in her upper chest. I tried to pin down what caused the problem. I ordered routine tests. All were normal. In desperation, I prescribed antacids, but her complaints persisted, and I simply became deaf. Several weeks later, I was paged to the emergency room. My patient had a dissecting aortic aneurysm, and she died. I have never forgiven myself for failing to diagnose it. Are your negative feelings fear and blame? Is stereotyping clouding your vision? Before committing to a decision, it is crucial to ensure that you have all of the facts and information you can obtain. Review what facts are known and what additional information needs to be gathered. Do you have a complete clinical picture? Are there laws that apply to the ethical issue? Who can assist or influence the decision-making process? It is tempting to delay the analysis of an ethical issue because you believe that appropriate facts are not available. But it is helpful to consider how facts influence your choices. For example, you may think it is appropriate to do one thing given a certain set of facts. How would a key change in facts affect your chosen action? Who are the stakeholders that will be affected by this issue? What values are most important for each stakeholder? For example, values like respect for decisions, confidentiality, trust, promise-keeping, justice, promoting well-being or avoiding harm. What is the key conflict in values that is involved? One patient, Stephen Schmidt, wrote a prose poem for his caregivers entitled, "When You Come Into My Room." When you come into my hospital room, he says, you need to know the facts of my life. And he lists many of those facts, those experiences, that aren't necessarily contained in his chart. When you come into my room, you need to know the losses of my life. And he lists many of the challenges of living for 12 years with Crohn's disease, like 3 small bowel resections and more than a dozen hospitalizations. But he also tells you that he is seeking healing, not cure, and that disease has narrowed his life, but not constricted it. Along with telling you that you need to know his body and his heart, He says that when you come into my room, you need to know my mind and my spirit. Here he lists the values that are important to him, such as seeking meaning in suffering, clinging to faith, and struggling with God. And most important, you need to know that I believe love wins over hate, hope over despair, life over death. You won't always get such an eloquent list of your patient's values, but you will always have to consider them. What are the alternatives that can be done in your patient's situation? Besides the 2 or 3 obvious choices, explore off-the-wall possibilities or ones that have obstacles as well. Considering the facts and values at stake for each option, what do you think is the best option and why? Once you have identified what appears to be the best choice, what values and facts support it? Anticipate being questioned about your justifications. How will you defend your actions? What precisely may occur as the result of your decision? Play out the sequence of events or process in your head to confirm that you've considered all the possible consequences. How is your choice supported by codes of ethics, literature, or established guidelines? In retrospect, what could have been done to prevent this situation? Are there any practices or policies that should be changed? What might you do differently next time? This process may seem time-consuming and cumbersome at first, but practice and real-world experience will demonstrate that this or a similar framework will lead to the best decision for all of the stakeholders.